I just got in from the healthcare rally here in Houston, Texas, and given that it was one of those rallies pro or in favor of the healthcare reform bill, I decided to interview some of the people there that actually opposed the bill. What is interesting is their their thinking, their way of thinking. It's almost robotic in the answers that are provided and very well scripted. It's amazing that you can watch Fox News, listen to Rush Limbaugh, Sean Hannity, Savage, and it all comes down to the same sound bites. Um, this is problematic, but at least we know where it comes from. Listen and tell me what you think.
So what is your position to healthcare reform?
Well, I believe that the effort that they're conducting right now is wrong, that the system may have problems, but it doesn't need to be nationalized by the Obama administration.
Okay.
And I think that if they allow the free market to work without government interference, as we've had for the last 40 years, they could probably cure a few problems, and at least we're not going to have socialized medicine like Canada or Britain or Venezuela.
Venezuela?
Well, I couldn't say.
What do you think of the system as it is right now?
I believe that there's been too much government interference.
In what respect?
The way the system has been conducted from the HMOs and the other government intervention and regulation, and lack of proper enforcement of what regulations they did establish, we've got a mess in that regard. Get the government out of the way, give us medical savings accounts, give us tax cuts, tax incentives, and then give some incentive for more doctors, and I believe that the problems that we may have now will work themselves out.
Okay, are you satisfied with the prices that you're currently paying for your premiums?
We don't abuse our health care, and we do have health insurance, and that when we need a doctor, we pay for a doctor, and we just haven't had any catastrophic events. And so I think that, like most Americans, we'd rather tweak the situation and cure whatever minor problems there are.
Right.
We sure don't want a nationalization of our healthcare system.
Do you think that our system would be nationalized if we had a payer that is the government but private control of the delivery of the services?
We shouldn't have the government involved. The government is involved in Medicare, Medicaid, and those are just boondoggles. There's rife with fraud and abuse. Why would we expect a system that has been increased from what it is now to not have an increase in fraud and abuse?
Would you pretty much do away with Medicare, or
the bureaucracy would be out of control?
Okay, would you like
the bureaucrats out of it?
Would you like Medicare to be dissolved?
I don't think that Medicare should have been established in the first place.
Okay.
They have a system now, and that people that rely on Medicare should still be able to get Medicare. We don't need to keep increasing it because it's unfunded liabilities, and I believe you're out of your zone here, sir.
It's okay.
No, it's not okay. They won't let us go over there.
Okay, we're here speaking to
Paula Bazan.
and
Tom Bazan.
I have one specific question with all the debate that's going on. Do you have any racial overtones with regards to Obama with your objection to this particular policy?
Color does not enter into it at all.
We're not racist.
Okay.
This color doesn't matter to me.
We just don't want a Marxist running our government.
Okay. And you do believe...
We do believe he's a Marxist.
I'm an American, and I'm here to defend liberty.
Okay.
And Obama's an American also, and we're here to protect and defend our liberty.
What's that?
Tell me something. What do you think about the current healthcare reform bill?
The current healthcare reform bill's got big problems all around. Part of it's abortion, part of it's a public option. What they need to do is just fix what's broken, not tear down the whole thing. Let us have our choices. Let us have what we need. Reform, bring the costs down, but no abortion, absolutely none.
Do you have a problem in giving those who want a choice of a public option that choice as well?
If it's a real public option, but not one that's going to take down the choice of the ones that already have health care. And if competition public option, they will drive the others out of business, and everybody will have to go on public option, which is not what we want, because it never works. It hasn't worked anywhere in any country.